The wide range of insurance coverage plans, as well as the underlying complexities, makes it difficult to understand who does what. Even medical professionals are somehow confused by the complexities of insurance, thereby making it difficult to advise patients. Though insurance provides a layer of financial protection from crippling medical debt, the protection is somewhat partial owing to an exponential rise in deductibles, out-of-network charges, the complexity of insurance that leaves consumers or patients with unanticipated bills, and minimal assets owned by people that could cover medical bills. 90% of adults with medical debt that has gone into collection have access to insurance, a phenomenon which evidences the fact that insurance coverage without the element of adequacy and affordability does not protect patients from debt. Insurance status has a strong relationship with the difficulty of paying medical bills, with slightly over half of uninsured people reporting that they have difficulties paying household bills. 1 in 5 people with healthcare insurance have it through their employer, 18% are covered by Medicaid, and 22% purchase their own insurance. Even the insured also have difficulties settling not only their medical bills but also others. 62% of people with household medical bills say the source of the bills was insured. For those with private insurance, deductibles make the difference between which bills are affordable and which ones are not, with those with higher deductibles reporting greater difficulties compared to those with lower ones. About a third of people with outstanding medical bills are required to pay $5,000 or more, including 13% of those with $10,000 or more in medical bills. The insured are less likely to report having more than $10,000 in medical bills at 8% compared to 21% for the uninsured. 24% of the uninsured and 22% of the insured struggle with bills amounting to less than $1,000, which could prove challenging for those living paycheck to paycheck. Some sources suggest that more than half of past due medical debt is less than $600, which creates a burden by crowding the spending on basic needs, thereby preventing long-term investment that focuses on wealth creation. 61% of those with issues surrounding medical bills make enough to cover their basic expenses, while 43% don't have enough to cover these expenses. Rarely do those with medical insurance have issues with covering their basic living expenses. Lacking insurance translates to even way higher out-of-pocket expenses, thereby opening up the uninsured to high amounts of debt. Medical bills leave patients in more fragile financial situations than before they accrued them. 29% of households with someone who has outstanding medical bills have had a family member cut their number of working hours to take care of the ailing one. As a result, 19%, or 1 in 5, report a noticeable decline in income. The uninsured are more likely to report job losses or pay cuts due to medical illnesses at 36% compared to 26% of the insured who report a similar phenomenon. 83% of the insured are insured when treatment begins and keep it throughout treatment, while 15% lose insurance, mostly due to a decline in income. Among those who have private insurance, 46% have medical debt issues and about half are on plans with high deductibles of up to $3,000 while the other half have low deductibles. 75% of the insured when bills are incurred find the co-pays, deductibles, or co-insurance highly expensive. Under plans with low deductibles, large bills arise from co-pays or from out-of-network co-insurance, but those with high deductibles still report greater issues with medical bills. Out-of-network coverage contributes to around 32% of those who are insured and are having issues with medical bill. 69% of those with medical debt issues arising from out-of-network treatment are unaware of the doctors in their network and whether the one they visited actually is. 26% of medical debts for the insured arise from denied claims, with the most common reasons for denial being A treatment service not covered under the patient's plan contributing to 25%, receiving care from an out-of-network provider contributing to 14% of the bills, and 21% not knowing why the claim was denied. Over 33 million Americans lacked any form of healthcare insurance by 2019. The expansion of Medicaid under the Affordable Care Act of 2010 resulted in wider insurance coverage, with the rising cost of care resulting from inadequate insurance coverage. An unintended consequence of the act was that the cost of insurance premiums rose significantly owing to the fact that the act prohibited insurers from discriminating patients on the basis of their health status. Before the act, people who were being treated for terminal illnesses such as cancer or heart-related diseases paid higher premiums compared to those without chronic illnesses because they're more expensive to treat. The elimination of patient discrimination on the basis of medical history implied that insurers raised premiums to achieve uniformity or equality. The impact of the high cost of premiums is evidenced by the fact that the rate on the uninsured dropped from 20% in 2010 to 12% in 2018, with the rates of the underinsured moving from 16% in 2010 to 23% in 2018. More individuals being insured implies more cost burdens with out-of-pocket expenses being more than a tenth of their income. High deductible plans as an approach to keeping monthly expenses low exposes families to higher out-of-pocket expenses. When high out-of-pocket expenses go unpaid, they're classified as medical debt and go into collections. Coverage remains unaffordable or unavailable for undocumented individuals, low-wage workers, and residents of low-income states that were not involved in the Medicaid expansion. The household spending for the average American is $3,000 annually, with a third of this figure going direct to out-of-pocket expenses. Let's go back to high out-of-pocket expenses for a moment. Medical debt is most commonly presented as a breakdown in the healthcare system. As repeatedly mentioned, for a lot of insured people, insurance doesn't exactly protect patients from medical debt. 6 in 10 insured people who have issues settling their medical debt cannot afford cost sharing, including co-pays, deductibles, or co-insurance. Deductibles have risen significantly since 2006, with deductibles in the case of employer-covered insurance jumping from $584 in 2006 to $1,644 in 2020. The primary contributing factor to the high out-of-pocket cost sharing is the high and unregulated prices of healthcare services, which are constantly being worsened by the rise in provider market power. The significant rise of market provider power is largely attributed to trends in hospital mergers and hospital-physician integration. Rarely does provider integration reduce care costs or improve the quality of care. On the contrary, consolidation allows large physician networks and dominant healthcare facilities monopolize the market and negotiate for higher care prices. In response to the restructuring of healthcare systems by dominant providers, employers and insurers have the resultant costs to patients by charging higher deductibles, co-payments, and co-insurance. Insurers also restrict access to desirable plans by offering limited benefit packages or restricting provider choices by reducing the size of networks in which patients can access care.